everyone, and welcome to the Voice of Pancreatic Cancer podcast. I'm your host, Miranda Weinberg with the Sina Magowitz Foundation. If you don't know about the Sina Magowitz Foundation, we're a nonprofit that's committed to the awareness, prevention, and cure of pancreatic cancer. Today on the episode, I have with me Dr. Peter Hosein, and he's with the University of Miami Health System. And we're going to be talking today about one of his patients with just an incredible inspirational story, Manny Garcia. Manny is actually going to be joining us on the podcast later with his family. But first, we're going to talk to you, Dr. Hosein. Welcome. Thank you so much for being with us.
Very nice to be here. Thanks for the invitation.
Well, I'm excited to talk about Manny Garcia. But first, maybe you can tell us a little bit about your background and how you got to where you are today.
Sure. So I'm from Trinidad in the Caribbean. I grew up there, did medical school there, and I came to the US 17 years ago to do my residency in internal medicine here at the University of Miami. I did a fellowship in medical oncology and hematology, and I've been working with pancreatic cancer since then. So I've been a little more than 10 years now taking care of patients with pancreatic cancer. And right now, my practice is probably 90% dedicated to pancreatic cancer. And the 10% would be other GI cancers. So I lead the GI cancer program here at the University of Miami as a lead medical oncologist, and of course collaborate with all the surgeons and the researchers here to take care of patients with this condition.
Okay, awesome. And so let's go ahead and jump into it, talking about Manny Garcia. I mean, why was his case unique? I mean, I know you're seeing pancreatic cancer patients, like you said, 90% of the time. So what was different about his case?
So, a lot of the patients we see are referred to the clinic, but I actually met him when he was in the hospital. So he started having abdominal pain, and then he went to a different hospital, and they found that his liver function was really bad. He was jaundiced. His liver numbers were off the charts. And they actually told him that there wasn't anything that they could do for him. And he kind of found out about our program and he came to the hospital here kind of out of desperation because he was told basically that he was going to die. So, they called me in to see him in the hospital. And when I saw him, I think he probably told you the story that, I told him that, the chances of bringing him out of that situation, his liver was shutting down. And it's very difficult to bring people out of that problem. And, the first step was very important, which was to confirm what type of pancreatic cancer he had. So as you know, when we say pancreatic cancer, we usually mean adenocarcinoma of the pancreas, which is the most common. But he, in fact, had a high-grade neuroendocrine carcinoma of the pancreas. And based on that diagnosis, we designed a treatment plan for him, which included chemotherapy to begin with. And of course, we had to use very low doses of chemotherapy because his liver wasn't working very well.
Right.
And on the first cycle, he got a low dose of treatment. He improved, and we escalated up. Eventually, after the second or third cycle, we went up to the full dose of treatment. He had a great response to the chemotherapy, and then it kind of plateaued. And that's when we introduced immunotherapy for him, which, at that time, the data for immunotherapy was still very, very new. And it's still controversial, I think, to some extent. But, for somebody at his age, I told him that, if we continue chemotherapy, we know how it's going to end because chemotherapy is limited. And, most people don't have long-term success with chemotherapy. So, I told him that my recommendation would be to take the chance on the immunotherapy. And the rest is history. I mean, he had an outstanding response. And, I would say that he is in what we would refer to as a remission right now because he has no detectable evidence of disease from a point where his body was really full of cancer a couple of years ago. And he also, we had some bumps along the road. It wasn't so smooth. After we started immunotherapy, he had a severe side effect with immunotherapy with his thyroid function. And also he had something called pseudo-progression, where it looked like his cancer was significantly worse after we started the treatment. But what we saw on the scan didn't line up with what we saw in him because he was doing great. The scan looked horrible. And we thought that this could be pseudoprogression. We continued. And I'll never forget that conversation that we had. We were sitting in the clinic. It was the day before Thanksgiving 2 years ago. And we just got the scan, and the scan looked really bad. He looked really good. And I told him, I think we should just continue for a little bit longer, see how things go. And the next scan he had was on December 31st, which was about 6 weeks later. Right. And it was completely clean. And I think on your website, you have that those pre and post scans, which it's incredible. When I show people those scans, they can't believe it. So it's very gratifying, of course, to have that kind of result, and I'm very happy for him. He's doing very well right now.
Can you explain pseudoprogression a little bit more?
Yeah. So when you give immunotherapy to a tumor which is immune responsive, you kind of get a flare reaction, because what happens initially is that the tumor puts up this shield which prevents the immune cells from infiltrating. So that your body usually has a competent immune system that can attack foreign invaders, right? So if you have a viral infection, the immune system would recognize that and create an immune response. And if your immune system were able to recognize a tumor, it would wipe it out. But most tumors have this protection called an immune checkpoint that prevents the immune system from recognizing it. So the drugs that we use in the clinic now are called immune checkpoint inhibitors, which kind of break down this defense or the shield around the tumor, and it allows the immune cells to come in. So in his case, because the tumor was so immune responsive, it created a huge inflammatory reaction. So some of these tumors actually increased in size a little bit. The activity level increased on the scan. And, if you didn't know what was happening, you would think that the cancer was getting worse. But it was actually a battle going on that we picked up on the scan. And, the battle kind of just fizzles out over time, and the cancer dies. The immune cells kind of just, go along their function, and that inflammatory reaction settles down. So we took the scan in the middle of this flare reaction, and that is what we refer to as pseudo progression. So it's not really real disease progression, it just kind of burns out over time.
And so you guys took a risk on doing that experimental therapy, and that's led to some case studies, correct?
Yeah, so we have, after his case, we use the same treatment in another patient with a similar diagnosis who had also the same kind of pseudoprogression response. So we put that together now for publication. It's not out yet in publication, but it should be soon.
And how do you feel about this treatment? I mean, growing into something that is more widely available for patients?
I'm very optimistic. I mean, I've had good experience with it. In this type of cancer, in high-grade neuroendocrine cancers that start in the pancreas or even in other organs, it is more commonly associated with lung cancer. But, we know that there is a role for immunotherapy. I think the challenge right now is to try to identify patients up front who would benefit. So we didn't have a way of telling initially whether he would benefit or not. So we kind of use it empirically. But, we are working on finding better ways of selecting which patients will be the most appropriate patients for this treatment.
And in all your years of, working with pancreatic cancer patients, how do you feel about the progress of treatment and different treatment options becoming available, and the progress of kind of understanding the patients better and what each patient
Yeah. So there's been a lot of progress in the last 5 years. We had a couple new treatment options coming out about 10 years ago, but I think the understanding of the disease and breaking up pancreatic cancer into subtypes of different histologies or different subgroups, and then even within the most common type, which is adenocarcinoma, breaking out a subgroup of patients who have certain mutations like BRCA or other similar mutations. That understanding has really increased significantly in the last 5 years, and really has been driven by research, in part funded by the Sina Magowitz Foundation, by PanCan. There are a lot of studies that have been done through advocacy groups like yourself that have really improved the knowledge and the understanding of the disease now. So, when I see a new patient today, it's a lot different than 10 years ago. We talk about genetic profiling of the patient, genetic profiling of the tumor, clinical trials that exist now that didn't exist before. So really, we still, of course, we have a long way to go, right? We have a lot of progress that still needs to be made, but I think we are moving in the right direction.
Awesome. Well, thank you so much for being with us. I know you're on a tight schedule, but is there anything I missed? Anything else that you wanted to add?
Well, I think Manny's case really highlights a few important points, right? One is that it's very important to figure out the right diagnosis. So, when you say pancreatic cancer, it's not always the same thing. So he had a very specific subtype that would respond to immunotherapy. But as you probably know, most types of pancreatic cancer, or the most common type, usually does not respond to immunotherapy. So making the right diagnosis at the start is very important. And then looking for a second opinion. A lot of people still have a sort of a nihilistic view of pancreatic cancer and cancer in general. But, for somebody at his age, we really pushed the envelope. And, I think it paid off, in his case, and we hope that he will continue to have good health in the future. But really, I'm very happy for him, and I'm glad that you all are highlighting his story.
Well, we're excited to be a part of bringing the message of hope. So thank you so much. We appreciate your time.
You're welcome.
I'm here with Manny Garcia and his dad, Noel, and his mom, Carmen. And we're going to be talking about his incredible story just with pancreatic cancer. And he's going to share some of his experience with us. So Manny and your family, welcome, you guys.
Thank you for having us.
Yeah, we have already been able to share in print your story on our social media, and it's just really resonated with people. So it's exciting to see that. What's that kind of been like, hearing people's reaction to your story?
It's been a really good feeling, since I got sick and everything and I've gotten better, it's always felt really good. Sometimes people they'll ask me questions about it and what was this about? And a normal reaction that I get is I'm sorry for asking about this, or they think it's too personal or something like that. And I always tell people no, bring it on. It's literally my favorite thing to talk about and to share and stuff. So it's always felt good to share people with personally my story and stuff, but then to kind of get it more out there a larger scope. It's a really good feeling.
Well, I'm excited that we'll be able to share it now on the podcast. I guess we can just maybe start from the beginning. I know it kind of all started when you were abroad, right? You guys were in Germany?
Yeah, I was in Germany with my father. Yeah. And we were there for, I forgot how long in total, at least a week and a half, something like that. About 10 days. And the first few days, while I was there, I was feeling fine, not really feeling anything off or a particular. And then it was from kind of one day to the next, I started feeling nausea and started feeling ill. And I had a hotel room to myself, and I remember that night, I threw up and stuff, and I wasn't feeling good. And then the next morning, I had no appetite. I didn't want to eat breakfast and stuff. So that's when I started thinking it's it's the travel. It's it's this, it's that. I'll maybe it's the food at this hotel. I'll kind of get over it.
Wow. And then, so when you got back to the States, it took a little while for you guys to figure out what exactly it was, right? They misdiagnosed you a few times.
Right. Yeah. So when we got back, it was already the beginning of March, I would say, give or take.
No, it was actually late March already.
It was late March at this point. So we get back, and then so I'm feeling off. At one point, my dad had to ask me while we were still over there. He's when's the last time you used the bathroom? All this stuff. And I was kind of that question never even occurred to me. I never experienced constipation before and stuff. I was kind of it's been 3 days. All this stuff, maybe that's part of it, all this stuff. So I go to an urgent care and they take x-rays and stuff. And I explain my symptoms, and the doctor at the urgent care kind of says like, yeah, like, you're obviously constipated. That's, it's, causing like this pain, like all this stuff. He basically told me, like take a laxative and that should make you feel better and all this stuff. So like, I follow his instruction and I do that. And then the pain just kept persisting. And it started coming in like more like frequently and like it was more constant. And then with each like passing day, it's like the nausea is getting like a little bit worse. And I forgot when exactly I noticed that like my stomach was like starting to like bloat, but it was like kind of like I was like developing like a little bit of like a gut and like a beer belly. And each day that goes by, like the list of palatable foods that I can eat is getting smaller and smaller. And what was that dish that I can only keep down at some point?
It was like a soup made out of like a potato, but it's not a potato. It's like
It's Caribbean
a
potato.
Caribbean potato.
A malanga.
Called
Oh yeah,
malanga.
crema malanga, we call
Yeah,
it. It's a root vegetable. Malanga is like a root vegetable, like a potato.
It's like a pureed type of.
And that's the only thing you could keep down?
Eventually, yeah, after like,
Wow.
a couple weeks, like when I got back from the trip in Germany. Yeah. And so I go to the hospital, I get a CT scan. And at this point, like I'm just like already from like the week or two before this, just like I was experiencing pain like all day, every day. Just taking like a deep breath was like agony. I couldn't lie down flat anymore and stuff. I was like constantly complaining to like my mom. It's like, oh, like this hurts so much. Like even just sitting in the car, like going to my appointments was like, was tough. And then so I get to the hospital and even like the nurses that like saw me there that like, checked me in, they saw like how much pain I was in and like all this stuff. So they like immediately like put me on morphine. And I remember like talking to the nurses, I'm like, are you sure like I need this? Like, you can't just give me like a big Tylenol or something? Like, I don't know. And they're like, no, like trust me, it's like you need this. And other than like when I got the endoscopy, because they put me under for that procedure, that was like it was the first time in like weeks that I was like felt like some kind of relief, like from the pain, like stuff. It's like, oh, okay, like I can feel like relaxed, like I'm like tense all the time and like constant pain and like all this stuff. So they take a urine test, they do the CT scan, and then so I'm there at the hospital and my mother's with me, and another nurse practitioner comes in and goes over the results from the CT scan and says, yeah, there's lesions all over the inside and outside of your liver, all this stuff, and you probably have lymphoma. I forgot like what verbiage she used exactly, but she definitely said the word lymphoma. And then, she kind of like says like all this stuff and like explains that it's like, we need to admit you. Like, you need to, you're going to stay here overnight. We need to run some more tests and like all this stuff. And then like she leaves the room and I'm like talking to my mom, and my mom was a little bit in denial. She's like, you don't have lymphoma. Like, that's not a doctor. That's a nurse practitioner and stuff. Like we're gonna get like the real answer here, like really find out what's going on. And kind of like the whole, like I'm just kind of like taking it in stride and right. The big shock to me was like, oh, like I thought I was gonna like leave here tomorrow. Like I have like appointments this week. I got like things to do and stuff. I'm like, what do you mean I'm staying overnight? Like,
yeah.
And so I was there. I forgot like how I went to Mercy Hospital in Miami, and so they admit me. And I can't remember if they did the biopsy like the very next day or like the day after, but at some point they take a biopsy of one of the lesions, and basically it was on Good Friday that April, like of all days to like discover this, that a doctor like comes back into the room and I have like my family like around me and like all this stuff. And she kind of had like a wordy way of explaining it. She didn't just come out and say like, we got the results back, you have cancer. It's like, she kind of had like this way of saying that it's like, yeah, so we got the results of the biopsy. We were looking at it under a microscope. Like she said like a couple other things and then said like, and the cells from the lesions are cancerous. And then she just looks at me and I'm just kind of like in bed there. I'm like, okay, so you're saying I have cancer? And she says, yes. Like, okay. Like kind of just like, like just thinking about it, like processing it, and like kind of like, what kind of cancer is it? And she says, we don't know. We know that it didn't start in your liver, that it spread there. I say, okay, and kind of like sit there for another moment. And then I ask her, I'm like, well, do you know what stage it is? Like, how bad it is? She's like, yeah, it's metastasized and spread to other parts of your body. It's at stage 4. And I remember like even like receiving that news, like all that stuff, like I was never really like filled with fear or dread or all that stuff. It was almost like kind of like, there was a side of me that was thinking, it's like, I should listen to my mom and gone to the hospital sooner. And then another part that was kind of like, well, that's why I feel so terrible. Like, that's why like I'm hurting all the time. It's like, oh, hey, like this is what that feels like, like go figure. And then once, we spoke to an oncologist there at the hospital, and he kind of had like I forgot exactly like how he explained it.
He basically hinted to me quite well that if it was my son, I'd take him to the Sylvester Center. I wouldn't stay here. Kind of look around, make sure nobody's looking. And, this is an older, experienced oncologist, but it's basically, all right, Doc, I don't need to read between the lines. How soon can you release this so we can, or can we transfer, how does it work?
Wow.
Yeah. So they started running like, some more tests to try to like determine like where it came from. And then I got out, I believe like the next morning, like on Saturday, or was it that?
No.
Friday.
We got out that Friday, and then my parents, they wanted to go straight to the hospital, but I kind of told them, I'm like, no, let me go home first. Let me go home. Let me spend like one more night, like, in my bed. Let me take like a shower and stuff, like, cause I'm kind of like, okay, well, I'm going to be in the hospital for a while. So I'm like, I insisted, like, let me spend like one more day at home. We'll go in the morning. So they let me do that. We went to the hospital the next morning and everything. And yeah, so it was a Saturday that we went, like, we went right into like their ER and everything. And we had some like extended family members through like a couple like degrees of like separation that like knew somebody that's like on like the board of directors there at and they were able to get me into a room like pretty quick. And normally at the hospital, it's like a 2-week wait time or something just to be able to get into a room and stuff. But they were able to check me in like, right away. And then the next day on Sunday, that's when we got like some more results back and discovered that it's like, oh, it's not only stage 4 cancer, it's stage 4 pancreatic cancer, which is like, especially deadly, Thanks to Dr. Hosein, yeah. And then, at this point, like I'm in the hospital, I'm in the 6th floor there at and they're, constantly doing like blood work, like at least like 4 times a day, doing like all these different things and kind of like explaining to me, like, day by day that it's like, my liver enzymes are like going like off the charts.
Mm-hmm.
Everything's like, like getting worse, like, like your body's like going into like in the red basically, that it's like, all this stuff. And I remember at one point, I'm talking to like a doctor that like did like some imaging for me, that they did like a PET scan for me or like a full body MRI or something like that. And she asked me, do you want to see the scans? And I said, no, I'm good. I don't want to see the scans. But I asked the doctor, I'm like, well, how many tumors is it? Is there like a number? You guys like count it and stuff? And she just looks at me and she looks up from her clipboard. She's like, it's a lot. I'm like, is it a lot? Like, it's a big number. You don't want to tell me? And she's like, no, it's a lot that we don't know. It's innumerable. Like how many tumors are just in your liver alone, let alone from like the main mass that's in your pancreas. And then, so like they do like a couple different procedures trying to like stabilize like my body and stuff. And like, and I'm seeing like different teams of doctors. I'm seeing a palliative care team. I have like the general doctors, the gastro doctors there. I lost track of how many different doctors.
It was definitely a team effort to try to at least get him to a certain point. I mean, there was a procedure done on him to try to put stents in his pancreatic ducts and his bile ducts out of his liver, trying to, release some of the toxins from his body. And that was extremely painful. Went through, it was successful, but it didn't work.
Right.
And at that point in time, the conversations got ugly.
And this is, I remember in your story that you said they talked about, what floor you were on.
Right.
And when that happened.
So it's basically like at this point that they're like explaining to me, like I'd probably been in like the 6th floor for like a week, like week and a half, like give or take, like something like that. Less than that.
Yeah, you were actually there for 4 days.
I was there for 4 days. Well, they remember. They remember better. But I was on the 6th floor, and I remember at one point, one of the doctors explains to me that it's like, so the chemo floor where we treat the cancer patients is the 11th floor. You know, we'd like to put you there, but there's a chance that you'll go to the 13th floor. And at the time I didn't even realize what the 13th floor was, because there's 13 floors in the hospital there at UM, and in the elevator it just says penthouse at the top for the 13th floor. So I'm kind of like, oh, I'm gonna get to go to the penthouse, I'm gonna get a better view, all this stuff. And they're like, no, the 13th floor is hospice. I'm like, oh, you'll figure it out, it's gonna be fine, I'm at the right place and all this stuff.
So you weren't, how are you feeling? I mean, emotionally when you heard that?
Emotionally, I felt good. I felt fine. It's one of those things, I've explained to people, that it's I didn't really have courage because I wasn't afraid. I had genuine fearlessness. I knew it was something that I was going to be, that I was going to get over that, and that it was going to take time, and that it was a process and stuff. The only times that I really kind of what was nice too was my family was there all day, every day.
Yeah.
They were there so much to the point that there were sometimes that I had to tell my family, I'm everybody go out, leave me alone, and go out to the hall, I'm watching Bar Rescue, leave me alone, I'm trying to I had no privacy, which was a wonderful thing that I had such strong support from my family. What was tough was when I had friends visit me in the hospital, my family's not around, and I'd have to explain it to them. Because with my family, I felt strong. I felt unstoppable. But then when I had to explain it to my friends, that's when it's the gravity of the situation really started coming in. It's this is what it is, and all this stuff. And at the time, they're still trying to dial me in on the right cocktail of pain meds and stuff. And I'm still having nausea and all these different things. And then the pain meds are causing more constipation, fighting with all the side effects of those other things that they're giving me and stuff. So at the time, I remember I just wanted to be able to eat and not feel pain anymore. The pain was the worst. My stomach was so bloated at this point that jaundice had spread to my skin, it was all yellow. I looked like a pregnant Simpson that was on Castaway or something. My hair was a little disheveled, my beard's growing out, my skin's turning yellow, and I have a big my bloating's getting worse every day.
Yeah, the whites of his eye were almost green. Literally, and that's how bad it was. It was,
yeah.
He had unbelievable spirits. I mean, he said something, but
I know it seems like you guys can look back on it now easier, but I'm sure mom and dad, that was really hard.
Well, he couldn't really move. We had to help him just move forward, to get out of bed, to use the restroom. I don't even know how he used it. So it's he couldn't move. He was in so much pain.
So when the doctor said to you guys, there's nothing that can be done, I mean, what was your reaction to that?
Well, we're terrible. It's kind of, part of me was well, check him out. I'll take him somewhere overseas, get a new liver. I mean, something. You can't tell me there's nothing that can be done. And fortunately, Wednesday, whatever the date was, Dr. Hosein showed up about 6:00, introduced himself, explained what he thought needed to be done, and basically, at the time, Manny, I guess, was between the oxycodone and the Dilaudid and the fentanyl, all the stuff he was getting to deal with his pain. He really wasn't there, but Dr. Hosein flat out told us, he goes, he won't walk out of this hospital if we don't start this process right away. It could kill him, but he's going to die one way or the other.
He's the only doctor that we saw through this whole ordeal that gave us hope. He was the only one. And
yeah,
this is a product of his work. Really.
And so it's there were all these different teams of doctors and different kinds of doctors and stuff, but he was really the first oncologist to come and see me in person and stuff. The other oncologists, they would just look at my chart and just basically give their response to a lesser doctor and deliver this what I have to say and stuff. But then I remember when he did come, I remember like the whole hospital floor was like abuzz, like kind of like Dr. Hossein's like coming here. It's like,
Really?
like the nurses and doctor, I'm like, oh, I guess this guy really is like some kind of big deal, or like some kind of like, you know, like hotshot doctor or something. And so like he came to see me and like, you know, explained like all the stuff to me and my parents and like my family and stuff. And which I remember like he kind of said it to me in like a way that's like, look, it's like, you know, we can't do a transplant, we can't do surgery, we can't like do like these other options that like normally like we can do, because it's like, you know, you're just like so like in the red right now, and like your body's like, you know, on the verge of shutting down. Or like even like other doctors had explained too that it's like they like, you know, they couldn't give me like basically kind of like how Dr. Hosein said it, that it's like, you know, they couldn't give me weeks or months to live. It's like, you know, it's like, you know, any day now, basically, you know, you'll just kind of like your organs will start shutting down. So Hussein like kind of like says like, you know, we can do nothing, we can hope for a miracle. And he kind of had like a cheeky way of saying it's like, and we all know that's not going to happen. Or we can try to give you chemo and water it down, give it to you at 25% strength, and hope that it's not too much for your liver and the rest of your body, that like your organs start shutting down. Because if we give you the chemo and your organs start shutting down, then it's like, you know, you'll be put into hospice and all this stuff. And then if we do nothing, obviously you're going to hospice. So it's like, basically it's our only option. And then I remember he just kind of like looks at me and stuff. And then I'm like looking at him like, oh, you need me to say yes. Like you need me to like agree to this and stuff. And I'm like, yeah. Bring in the card. I'll sign the thing. Like do the thing, like all this stuff.
Yeah.
So then they moved me to the chemo floor.
Yeah. In the meantime, all this, the University of Miami had to agree to allow him to do this, because this is not, you know, FDA. It's not, you know, it's all experimental, clinical, whatever you want to call it. And as he's talking to him, his nurse tells him, doctor, the university just agreed to it. So he's already telling he's going to do this. Now he's, you know, he's a very humble person when you talk to him, but you can tell he's like, of course I'm going to do it. I said so. But, you know, in a very nice way. And that was at 6 o'clock. By midnight, they had started Manny on his on carboplatin and
etoposide.
And etoposide.
Etoposide, yeah.
Drips at 25% with the hopes that it would work.
At midnight.
And
Wow.
and I remember I'm pretty sure I slept through my first like infusion.
You did.
Like I was sleeping a lot because of like, you know, the pain medications and stuff. Like, you know, I was like, you know, took lots of like naps and things. And I remember like, you know, waking up from like, you know, from after they did like the first infusion and everything. And I can't recall exactly like how I felt and stuff. I was just kind of surprised. I'm like, oh, they did it already? Like that? Like I thought like, you know, I'd like wake up or something or like all this stuff. And then already, you know, they were checking my blood work like every 6 hours, you know, all hours of the day. They'd even wake me up every day at like 4 a.m. to like take my blood work and all this stuff. And then already from like my first like blood work, it's like, you know, the levels of like my liver enzymes and stuff like started coming down. And
Every day he improved. Every day.
Every day I improved. So they did that first infusion, and then they watched me for like another day and a half, like to have me like on like observation to make sure that it's like, you know, there wasn't any adverse reactions or all this stuff.
It was actually a week.
It was a week?
Yeah.
Okay, well, my was a little off during that time.
Yeah.
So they watched me for a few days, but, you know, basically after that first infusion, everything started getting better. I was like eating more, like all this stuff. And then I was able to go back home, you know?
Incredible.
And that was a weird feeling too, like the first time, like being able to, like, that I went outside, like, you know, in weeks,
Right.
or, you know, all this stuff, and like actually like smelling like the fresh air, and like, you know, like riding in a car, and it's like getting back to my house, and it's like taking a shower, like in my shower, and getting to like lay in like my bed and stuff. It was serene. It was crazy.
That's awesome. Okay,
Yeah.
so then from there, after, you know, you got discharged to home, what's the journey been like?
So, I mean, you know, basically, like, I remember at some point, you know, like I work with my father and, you know, my brother, and like, you know, it's a family business and stuff. But I remember at some point my dad told me, he's like, your only job right now is to get better. Like, and so 3 months go by, and then like by the end of August, Dr. Hosein, like, I forgot exactly how he said it, but he says that said something along the lines of like, oh, you know, the problem with like chemo and this disease is that since it's a poison, it's just a matter of time before your body develops an allergic reaction to this. There's that. Then the cancer itself, like kind of like it gets like more resilient to the poison, all that stuff. It's like a temporary fix. It's like it's not always like a method to be cured and all this stuff. And like talks to us about like immunotherapy. You know, let's do treatment that uses your own immune system to fight the disease. That it gives like your white blood cells like certain proteins and certain things that makes the tumor cells think that they're friendly. So it lets in your immune system and uses your own immune system to fight the disease. And so after about 3 months of chemo, we switched from chemo to immunotherapy. And then
it was an experimental immunotherapy, right?
Mm-hmm.
Yeah, it's FDA approved for some cancers. Like I think they use it for like lung cancer and stuff, but it's definitely not FDA approved for mine. It's a miracle that it was even covered by insurance at first, that like, you know, my insurance was still willing to like cover like all the things and stuff. And then once I got my first clear scan, it was on it was that year, New Year's Eve, right? In 2019.
Yeah.
He actually took a step back. He had a scan the day before Thanksgiving, or 2 days before Thanksgiving, actually. And it showed major worsening. Dr. Hosein said it's one of two things: or the cancer's really, really spread, and we failed, or this is pseudo progression, and it's not real. It's just blowing it up in such a way that it's all over your body. And he told Manny, you know, gave him the option: you either go back on chemo or continue with this.
Yeah.
Manny's response was pretty, you know, I'm here because of you. And you always said immunotherapy would save me, so let's go.
Yeah. And I remember at some point after, like, from my like next scan or like my next couple appointments, like Dr. Hosein said to me, it was like, that was one of the hardest calls of like my career and stuff, like seeing that. Because it's like, you know, the medical scan, which is like, you know, like the scientific tool that we're using to like measure this, it says that it's like this has gotten worse and it's off the charts. But he was doing like a physical examination of me and stuff and asking me all these questions. I'm like, I feel fine. I mean, obviously it's like, you know, I could feel better. Like I still have nausea and like some pain and stuff, but it's like, I don't feel anything like I did like, you know, like a few months ago and stuff. Like, you know, I feel like I'm getting better. And like all this stuff. So the scans didn't match up with what Dr. Hosein was seeing. But he still gave me the choice. Like, what do I want to do? And I said, well, I want to stick to your plan, you know, like, you know, with how, you know, we said it was going to go. And then the following scan after that was my first clean scan. And he called me on New Year's Eve. And I remember my parents gave me like a bunch of grief and stuff, because even like throughout this whole process and stuff, it's like, I knew I was going to be fine. It was just a matter of time. It was a question of when, not if. And so I'm on the couch, like watching TV and stuff. Like, I forgot what time it was exactly, but like he called me and I was kind of like, oh yeah, that's awesome. It's great news. Like, thank you. Like all this stuff. Like I could tell like he's in a really good mood, like all this stuff. And then I just went back to watching TV. Like I forgot to tell like my parents and stuff.
You're kidding me.
And at some point, like my mom or dad like walks in and it's like, you got a clean scan? I was like, oh yeah, that's right. Yeah, Dr. Hosein called me earlier. Called me like a few hours ago, like all this stuff. And they're like, and you didn't tell us, like all this stuff. I'm like, oh, I forgot. I'm sorry.
Like one message you probably want to tell your parents.
Yeah. I mean, I found out it was a good scan just because when the scans were good and you know, moving, you know, better than before, he would post them on his UHealth chart and we could post online. So I get a notification that his test results are there, and I'm like, wow, it's got to be good. And then I'm like, Manny goes, oh yeah, Dr. Hosein called me. I'm like,
I got to know, what was the TV show? Was it Bar Rescue that you were watching?
It probably was.
I never want to see that again. And also along the way, before he got the clean scan, before the blowing up cancer pseudo progression, he had like some spots in his brain and in his clavus, the back of the neck.
Right. Yeah. So during this process too, so like the pseudo progression, that's like one of my case studies that Dr. Hosein like has written a case study about. And so like at some point, like, I'm here at home and I'm taking a shower and the water's like hitting my face and I'm feeling numbness on just the left part of my bottom lip. It's just like a particular section. Okay. And I'm thinking to myself, like, that's kind of weird. And I remember like thinking about it. I'm like, maybe that could be nothing. Maybe my lip just fell asleep in a weird way. Like, I don't know. But then like part of me was kind of like, you should probably let the doctor know. Like, that's not like exactly like normal, like all this stuff. And so I emailed Dr. Hosein about it, and Husein's like, no, that's not normal. Like, we need to take like, like, let's do a brain MRI. And so they do an MRI, and then they spot another tumor in my clivus, which is the last bone in your spinal column where your spine connects to your head. And then 2 small brain tumors, one in my frontal lobe and another one like in another part of my brain, like towards the back. I forget like the section exactly. And like the doctor was explaining how it's like, yeah, like, the immunotherapy's like been working for like everywhere down here, but basically like the cancer's like in your blood, like ultimately it can spread anywhere. And that like your head has like these normal like kind of like blockers that like kind of prevent the immunotherapy treatments from like actually getting up in there and stuff. So for that, they had to take a biopsy to be sure.
What were your thoughts? I mean, after you just got your clean scan, you like think everything's all done, and then all of a sudden you get this news that there's more. A
lot of thoughts of like, man, what a pain in, what a pain this is, like, and kind of like, man, it's like, I knew like I was gonna like beat this and be done with this, but it's like, this is taking longer than I thought. But then like a lot of times like I have those thoughts, like I'd also have to be like reminded and stuff that it's like, it's like how fortunate I am, like how blessed, how lucky I am, and like all this stuff. And that it's like, not everyone gets to get off this way and stuff. So it's like, I kind of, when I get impatient and stuff, it's like, cause it's like, it's like, I just want my life to go back to normal, to how it was like before all this. Mm-hmm. And like to keep on like with my life and stuff. But then it's just kind of like, these things just don't like go away overnight. It's a process. It takes time. Like, respect the process and just do the things and stuff. So that was my biggest thought, is like, oh, what a pain. This isn't done already. Like, ugh.
I have to be honest, I've, interviewed a few different pancreatic cancer survivors and people that are still fighting. And you have such an attitude of, knowing that it's going to be okay at the end. It's incredible. I'm just wondering where that attitude came from. I mean, mom and dad, has he always been like this, or is this a family trait?
Yeah.
Well, we're positive people. We have faith, and we have a very strong family, very strong support system. I mean, Manny was sick in the hospital, whatever, and I run a small business, and his brother and his sister basically said, I told Manny, your job is to get well. And they told me, your job is to make sure Manny gets well. Forget about the business. Don't worry about it.
A lot of times it can be, hard, or just from interviewing people, I've seen that it can be hard to kind of walk through it all and relive it all again, telling the story. But it is so cool that it's timely that this is your last infusion treatment.
Mm-hmm. Yeah.
So, and like you were saying, Noel, the things are always changing. I mean, that's the case even with the therapy that they used for you, right, Manny? I mean, now they're working on getting it FDA approved.
Right. Yeah. So that's another one of my case studies that like Dr. Hosein wrote and stuff about how it's like, like I haven't read it for myself, but it's basically like along the lines of like, I've had dozens and dozens of patients that, have passed away, that like, what could have been if like I was able to like give them this kind of treatment and like, give them hope and like have like another option to like, fight this disease and everything. So it's like that's like another thing that feels really good too. It's not just like, oh, I got to live and I got to keep living and like all this stuff. It's like, by doing so, it's like I get to help others in like, a really big way and stuff. So it's a fantastic feeling.
Oh, and
go ahead.
I wanted to mention also that when you have somebody in your family that's ill, whether it be your son, your husband, your mother, your sister, I, for example, was really, really devastated. And I was looking for somewhere, even on social media, to find somebody that could have a story, that could tell their story. So gives you hope, you know, and it helps you to deal with the fear and the struggles and the daily up and down of this disease. So I think this is like huge that, you know, I mean, even though he's really young, but he's come out of it so well, and with such a great inspiration to others that might be watching this, and gives them hope also, you know, that it is beatable, that it is important to have a really good attitude and a good support system, and good doctors and good teams.
You know, one of the things that Manny has a really great heart, big heart, and he's talked to people already, and he wants to help people, you know, share his story and, you know, everything else, and give people hope. There are going to be bumps. This isn't going to, you know, it's not a magic wand. It doesn't go away in a day. There's going to be some bumps, but, you know, this is a lot better than you know, what everything that's been out there from before.
Yeah. I mean, it's true. It's so powerful when people share their stories, not only for other pancreatic cancer patients, but for their families. Like you said, Carmen, I mean, you were looking anywhere for hope because you had to be strong for him. So I am so thankful for all of you guys for taking your experience and using it to help others. And that was another thing I wanted to ask you about. I saw in your story that you mentioned that the whole experience has brought you guys closer as a family.
Yeah, absolutely. And like, you know, it brought me like obviously much closer to like my mother, my father, my brother, but even like my extended family, like, you know, aunts, uncles, like cousins and stuff, that it's like, you know, I get like, you see it like not just with like family tragedies, but like tragedy in general has like this way of like kind of like, you know, making people like, you know, stick together in like a weird way, that it's like when some of the most awful things happen, it's like, well, it's like, you know, what we got to stick together and like be strong. So it's like, it's just something that's made my family like stronger than it's ever been.
That's awesome. Well, is there anything that you want to add? Anything that we missed on telling your story?
Not that I can think of. That I think that kind of covers it.
I talk too much. You know, cut me off already.
Well, I think it's funny
I
that
had a good weekend, so.
Yeah.
Yeah.
it's interesting that the doctor said, you know, we can hope for a miracle, but that's not going to happen. But I mean, I really do think that your story is miraculous. So thank you for sharing it.
Yeah. Thank you.
No, thank you.
Thank you for doing this interview and for having us. Yeah.
And we're here to help any way we can.